racism to remote health monitoring. At 40 weeks, my blood pressure decided it wanted to creep up. That, combined with swelling and increased protein in the cup, were indicators that my body was under an abnormal amount of stress, so my midwife checked to make sure my baby wasn't in distress. After confirming that she wasn't, we made the decision to induce because there was no way I was going to the hospital with COVID on the loose. We decided to start the process at 12:30 the next day before the diagnosis of preeclampsia could have the final say. Because I know that once labeled, put in a box and categorized, protocols can result in a woman's desire to design being trivialized. It could have quickly gone from allowing me to try for a natural delivery to an onslaught of medical interventions presented with chivalry. From bed rest, magnesium drips, epidurals, and Pitocin, to baby distress, time constraints, and an imbalance of oxytocin, to a C-section delivery because they had to get the baby out. And please hear me, I'm not saying that this is never the right route, but what I am saying is that many cesarean deliveries can be avoided if a mom's designer, and inherent power were null and voided. If she knew that unnecessary medical intervention can actually slow progression, and that although Pitocin strengthens contractions, it can also result in regression. That it can cause her uterus to squeeze too forcibly and make it hard for her baby to breathe. And that instead of her getting rest between contractions, she could feel like there's no reprieve. You know, it's the lack of true informed consent that presents the biggest issue, and all that trauma goes on to invade and take up residence in the mother's tissue. It manifests itself later as fear of getting pregnant and having self-doubt, when all she needed in the first place was time to let her baby come out. So with nipple stimulation, position changes, and the strategic breaking of my water, modifying of my movements and breathing based on what was noted on the monitor, the belief of my family, midwife, and doula that my body could indeed do it, and the strength of my Heavenly Father along with a warm bath to get me through it. My daughter was born in 4 hours and 47 minutes in the water. It was promptly placed on my chest within seconds of when my midwife caught her. While my husband cut the umbilical cord and my vaginal tears were repaired, my newborn breastfed with her big brother and self-appointed protector there. After a few hours of ensuring that my body settled down and our baby was okay, my midwife left me with orders to rest and take my blood pressure twice a day. But rest is relative, right? So as is customary when a new child makes an appearance, we invite family over, did a newborn photo shoot, and considered this adherence. So within days of delivery, my blood pressure climbed to unprecedented heights. And in writing this poem, I realized that it was my body exercising its rights to tell me that I was overdoing it, that my blood vessels and kidneys needed time to heal, that the threat of kidney failure and having a stroke after delivery were all too real, that I had resources and support and I needed to use them to the fullest capacity, or the things the OB said that I was assigned to following delivery could have some veracity. To my face, he said, your kidneys won't recover. I've had patients like you before. You'll be on blood pressure meds for the rest of your life. Can you imagine what he said behind closed doors? I'll tell you that. He said he knew I didn't have a regular doctor and wouldn't follow up with him if I did. And then on the off chance that I survived, my body wasn't fit for having another kid. That considering the fact that I was older, black, and lived most of my life in the South, he was certain I had high blood pressure pre-pregnancy and couldn't control the foods I put in my mouth. He didn't care that my records showed my blood pressure average to be 100/60, or that I worked out almost daily and my resting heart rate barely made it to 50. Or that when the preeclampsia was discovered, my blood pressure was about 128/80. So I'm pretty sure that had he been my birthing provider, his assumptions could have killed me. And this is one of the mistakes that underlie maternal death, infant mortality, and abortable complications, along with protocol-driven induction, C-sections, and a lack of individualization. There's the lack of inter-collaboration, communication, surveillance, and care coordination, referrals to other healthcare providers, and inter-office visit recommendations. Think about it. For every woman who has a kidney injury, there's a renal doctor who can help. For every bony malalignment, there's a chiropractor with experience under his belt. For every instance of uncontrolled high blood pressure and heart failure, there's a cardiologist. For every woman who needs higher surveillance during pregnancy, there's a periodontologist. For every vaginal tear, displaced uterus, and weak pelvic floor, there's a physical therapist. For every woman struggling with anxiety and postpartum depression, there's a mental health specialist. There are doulas who are present for labor, delivery, and afterwards to provide intercession. The point here is that for every need, there's a healthcare provider who can provide intervention. But the reality is, with the pace of the current healthcare system, things can be missed. And issues witnessed, experienced, and communicated are inadvertently or intentionally dismissed. So Operation M.I.S.T exists and persists to fill the gaps and shore up the team, so eliminating the maternal health crisis can become more than just a dream. Now, instead of women being seen 2% of the period, they're at risk for complications. Their vitals are monitored 100% of the time by healthcare providers from a remote location. Providers who learn the details of a mom's day-to-day life, desires and fears, the nuances of her diet, exercise, commitments, stressors, and what brings her to tears. They combine what they learn with information from a smart device to establish a unique baseline. And since women are never compared to anyone else, their physiology is never undermined. When she deviates significantly from her norms through text or phone call communication, a brainstorming session ensues with her M.I.S.T monitor to determine the cause of the deviation. Most of the time, the underlying issue can be corrected, lifestyle modification. But on occasion, the changes warrant deeper and more extensive investigation. To that end, our moms have embraced self-advocacy and discovered the power of asking questions, and thus have avoided unnecessary inductions, preterm deliveries, and cesarean sections. Between office visits, infections, anemia, heart issues, and preeclampsia have been identified, and self-prioritization plus early intervention resulted in every issue being rectified. Operation M.I.S.T gives moms and birthing providers what they need to make data-driven decisions. It removes bias and racism from the equation, demanding a higher level of precision and provisions. It gives women the numbers they need to get a second opinion if their symptoms are dismissed. For we know that when armed with objective data, less women will be affected by this. It exists so women can have better outcomes and make more informed and confident choices, so that when asked about their birth stories, those listening hear joy and peace in their voices. It exists so women don't settle for just being grateful that they and their baby survived, but instead are able to revel in the fact that they did everything they could to thrive. It exists so women are emboldened to make choices now that won't negatively impact them later, and so they activate the power within that was strategically placed by their creator. It exists so women can get back to being in tune with and trusting their intuition, and so that the maternal health crisis no longer instills fear, but results in clearer vision. This poem was written so you would know the why behind our unrelenting determination to educate as we live up to and follow through on the following dedication. On our honor, we will strive to save moms and their babies, to monitor faithfully, intervene meaningfully, and create an environment where both can thrive. Thank you.